If you've been diagnosed with early cataracts, or if you'd like to just never be diagnosed with vision-changing cataracts, then this video should help you a lot. I'm going to tell you 5 tips that theoretically should slash your risk of ever developing severe cataracts. Here are the 5 tips that could potentially reduce your risk of developing vision-limiting cataracts by 80 to 90%. Number 1. Now, another thing that you really need to know, and it's going to make sense when I tell you the 5 tips.
More and more people are developing cataracts as they age. Typically what a person will do is they may get surgery. Well, sometimes there are complications to that surgery. It's not a complication-free or side effect-free surgical procedure. I mean, in one study, 42% of people who get cataracts develop dry eyes. 20% get the droopy eyelid. And there's other complications like floaters. So personally, I would try more of a natural route first. Since they have very little side effects, why don't we take a look at the mechanism of what causes a cloudy lens, which is a cataract, and then use some type of natural remedy that makes sense, that really has very minimal downsides compared to drugs and surgery.
Number 1, stop smoking. Pretty darn good research shows that smokers have a double up to a triple the risk of developing cataracts than non-smokers. And this probably works because smoking oxidizes every cell in your body, including the cells in the lens of your eye. Now, there are 4 basic principles. This is what leads to cataract formation. So anything that you can do to prevent these 4 things from happening are going to decrease your risk of having cataracts, or at least of having severe vision-limiting cataracts. So here are the 4 ways that we know that lens cells in your eye can be damaged.
The lens in your eye is made up of proteins that are carefully arranged to keep your vision clear. But various factors can damage these proteins, leading to cataracts. Here are 4 major risks that can alter the proteins in your lens, increasing your chances of developing cataracts, along with some examples. Radiation and trauma. Exposure to radiation or physical trauma can directly damage the proteins in your lens. For example, if you undergo radiation therapy for cancer, the radiation can alter the structure of these proteins, causing them to clump together and form cataracts. Similarly, a strong blow to the eye or head can cause trauma that disrupts the proteins in the lens, leading to cataract formation. Protecting your eyes from injury and discussing protective measures with your doctor during radiation treatments can help reduce this risk. Glycation. Glycation occurs when sugar molecules bind to proteins in your body, including those in your lens. This process can cause the proteins to become rigid and less transparent, increasing the risk of cataracts. People with diabetes are especially at risk because high blood sugar levels accelerate glycation. For example, if you have poorly controlled diabetes, the excess sugar in your blood can damage the lens proteins more rapidly, leading to early cataract development. Managing your blood sugar levels through diet, exercise, and medication is crucial for preventing this type of damage. Oxidation. Oxidation is a process where free radicals, unstable molecules, damage cells and proteins in your body. The lens in your eye is particularly vulnerable to oxidative stress, which can cause the proteins to break down and clump together, leading to cataracts. For instance, smoking and excessive sun exposure both increase oxidative stress in your eyes, speeding up the development of cataracts. You can protect your lens by avoiding smoking, wearing sunglasses that block UV rays, and eating a diet rich in antioxidants, like vitamins C and E, to neutralize free radicals. Genetic factors. Sometimes the risk of developing cataracts is written in your genes. If you have a family history of cataracts, you may be genetically predisposed to changes in the lens proteins.
Number 2, try to avoid corticosteroids as much as you possibly can. Definitely corticosteroids by mouth, but also even inhaled steroids seem to have the same effect on the lens of your eye. So if you have to take a steroid for some medical purpose, please ask your doctor. Talk with your doctor about limiting the corticosteroid to the shortest amount of treatment time possible. Number 3, you need to eliminate all added sugar from your diet. And this includes sugar that was added by you or by your mama or by the factory that made the pseudo food that you're about to ingest that has added sugar. Never drink added sugar, never eat added sugar. And this goes directly to the glycation. Anytime that you eat or drink enough sugar to raise your blood sugar level, you're glycating every tissue and every cell in your body, including the cells in the lens of your eye. You don't want to glycate any of your cells any more than they should be. So eat a low sugar, sugar-free enough diet to keep your blood sugar levels normal, and this should greatly reduce your risk of ever developing cataracts. Number 3 is to eliminate all grains and all starchy vegetables from your diet. When you chew up grains and swallow them, they turn immediately into sugar. Starchy vegetables have lots of starch. Starch is just lots of sugar molecules holding hands. As soon as you start to chew up any bread or anything made out of grains or any starchy vegetable, they immediately start to turn into sugar. So eating lots of grains and lots of starchy vegetables and lots of fruits, even though you're not eating any added sugar, it still has the potential to raise your blood sugar and increase the glycation of all your cells, including the cells inside your lens. Now, another thing that you really need to know, and it's going to make sense when I tell you the 5 tips.
There's a nutritional remedy called NAC in a drop form that you can use on your eyes. And the NAC remedy I'm going to recommend is kind of confusing because there's 2 types of NAC out there. One is N-acetylcarnosine, and that's the one that you want. You don't want to get the N-acetylcysteine, okay? Now that's good for other things like addictions, especially a fatty liver, but the one for the eye, N-acetylcarnosine, is very specific as an antioxidant to help reduce cataracts. Now, the carnosine that acts as an antioxidant can't really penetrate the surface of the eye, and that's why this other compound is added to carnosine, the N-acetyl part of this compound, that allows it to penetrate into the first chamber of the eye, and that's where the lens is, so it can do its work. So these NAC drops are another thing you can add to the protocol. I would also recommend consuming eggs, especially the egg yolks. And make sure that they're runny as well, because egg yolks are just loaded with carotenoids, which is good for the eye, as well as anthocyanins, as well as something else called choline. And choline has some additional cool effects to counter dry eyes.
Before we continue, please like and subscribe to support our channel. Your support helps us reach more people with our videos. Thank you.
Number 4, you need to eliminate all of the vegetable oils from your diet. Canola, soybean, peanut, sunflower, all those need to go. You need to eliminate all the margarine and all the vegetable shortening from your diet. They are very, very foreign to human physiology. We've only been eating them for a few decades. You need to eat instead the ancestral fats that we've been eating for millions of years. The reason for this is that these vegetable oils are very oxidizing. They inappropriately oxidize every cell in your body, including the cells in the lens of your eye. Now, if you've already been diagnosed with mild to moderate cataracts, you may be asking, well, if I make all these changes, is it possible that I could stop the progression or even reverse my cataract and improve it? That's possible. There's no research showing that yet, but it makes perfect sense that if you stop all the sources of oxidation and all the sources of unneeded and unnecessary glycation, that you may very well, almost assuredly, slow down or stop the progression of a cataract, but you might even be able to reverse it to some extent. And a final tip is to avoid alcohol as much as you can. There's some limited research that shows that there might be an association between drinking too much alcohol and cataract progression. Why take a chance? Alcohol is a known toxin to every cell in your body, so it's probably true that it's a toxin to the cells in the lens of your eye as well.
Now, the remedy that I'm going to recommend to help potentially decrease the risk of cataracts is going to be a shake. It's going to be composed of berries as well as kefir, because kefir also has some interesting things in it that can also help reduce the risk of cataracts, and one being dietary calcium. There's definitely this association between getting enough calcium from dairy and having less cataracts. Then you also have all the probiotics in kefir, which, by the way, is way more than yogurt. And there's even some interesting studies on yogurt helping with cataracts. Well, kefir is much stronger than yogurt. Kefir also can help with other things like infections in the eye, like pink eye. And anytime you're doing kefir, I highly recommend that you get the unsweetened version of kefir. Get the whole milk kefir, not the low fat. And make sure the kefir is from grass-fed animals, whether it's goat, sheep, or cow. So you're simply going to mix 1 cup of berries with 1 cup of kefir, and you'll blend it up and you'll drink it down. Now, sometimes the kefir is pretty thick, so in that case, you might have to add a little bit of water to thin it out, or you can just consume it with a spoon. Now, the question is, what kind of berries should you use? You can really just use any of the berries because they're all pretty high in anthocyanins. And what you'll do is you just take a cup of that, mix it with the Kefir, blend it up, and consume that once a day. Combination of this high quality Kefir with this anthocyanin rich berry mix is going to produce a really cool effect on your eyes. And not just for the lens, but for the macula, which is the back part of the eye, and the other tissues. It can help counter some of the complications of all this oxidative stress.